Let's explore an important IT security scenario focused on managing legacy systems in healthcare environments. When dealing with medical equipment running outdated operating systems, IT professionals often face significant challenges, balancing security with operational requirements. The core issue centers on medical instruments operating on unsupported systems like Windows Server 2003 or Windows 7. These devices present unique security considerations because their vendors no longer provide security patches or updates. This situation commonly arises in healthcare facilities where specialized medical equipment depends on specific operating system versions. Consider a practical example from a small hospital setting. Their optical devices continue running on Windows 7 due to the intricate relationship between the operating system and the device's specialized software. The vendors have determined that updating these systems would require extensive code modifications, potentially disrupting critical medical services. To address this security challenge, alternative protection measures become necessary. These solutions often involve implementing compensating controls while accepting certain operational limitations. The key is finding a balance between maintaining device functionality and ensuring adequate security protection. From a security and compliance perspective, healthcare organizations must document these scenarios carefully. This includes risk assessments, implemented compensating controls, and ongoing monitoring procedures. The security strategy focuses on isolating these systems while ensuring they remain functional for their intended medical purposes. Let's explore network security zoning and essential compensating controls for legacy medical devices. When dealing with outdated medical equipment, physical isolation serves as a primary security measure. This approach ensures critical clinical functions continue while mitigating security risks. Network security zoning creates distinct security levels across different network segments. The architecture consists of carefully planned boundaries implemented through firewalls, access control lists, and network devices like switches and routers. These components work together to enforce security policies appropriate for each zone. The Internet zone represents an uncontrolled environment. This means special attention must be given to security measures protecting internal systems from external threats. The implementation of security boundaries requires careful consideration of data sensitivity, user access requirements, and operational needs. For legacy medical devices, a practical approach involves placing them in isolated network segments with strict access controls. This means implementing rigorous physical security measures and carefully managing any necessary network connections. The key is maintaining device functionality while preventing unauthorized access. The security strategy focuses on creating clear boundaries between zones with different security requirements. These divisions help protect sensitive medical systems and data while allowing necessary operational access. Critical to this process is maintaining detailed documentation of implemented controls and regular security assessments. Let's explore the concept of network segmentation and its critical security zones. At its core, the organizational network infrastructure consists of several distinct security zones, each serving specific purposes and requiring different levels of protection. First and foremost, the Internet DMZ zone, while external to the organization, maintains controlled connections to our network infrastructure. This zone operates with two firewalls and hosts public-facing servers, creating a defensive barrier between the Internet and internal networks. The production zone functions under restricted access protocols. What sets this zone apart is its strictly controlled access mechanisms, ensuring robust security for critical operations. Moving to the Intranet zone, this area serves administrative personnel with controlled yet less restrictive access compared to production environments. For instance, manufacturing areas within the production zone require enhanced security measures to protect critical manufacturing processes from unauthorized access. The management zone operates as a secured environment with strict policy enforcement. In practice, management zones often overlay existing intranet infrastructure To illustrate this configuration, virtual local area networks, VLANs, enable network device management traffic to utilize the same physical infrastructure while maintaining logical separation. This means that while management data travels through shared physical cables, VLAN segregation prevents unauthorized access to management functions. These configurations help ensure proper network segmentation, with each zone serving its specific purpose while maintaining appropriate security levels. The key is understanding how these zones interact while maintaining their security boundaries through proper access controls and monitoring.